that the role of the CIO has changed totally. You know, we were software developers and architects, and we could tell you what RAM to use based on its transactional speed. Do you think any of that matters anymore? The answer is no.
Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. I was the CIO for a 23,000 person health system, and one of the biggest challenges was to remain current on the technology and the trends that were going on myself.
Think of artificial intelligence as a orchestra. Right now, machine learning, deep learning is getting a lot of attention, so I sort of equate that to the string section. And obviously there are many sections to the orchestra, so someday soon, hospitals, healthcare organizations are going to be able to have amazing music.
We are seeing instances of folks popping up, us included, where we're having a primary care physician set up with the dentist in the same office.
I would love to get to the space where eventually we're using voice recognition to do all of our navigation throughout the electronic health record.
When we worked at Microsoft, oftentimes, you'd have crazy deadlines. People would say, look, we're not saving anyone's life here. We can't say that anymore. And we love that. It's like we can save someone's life. We can prevent a complication or a readmission by catching it.
A lot of the feedback people are hearing about former Vice President's remarks is that he was remarkably pragmatic. And then the one that I'm most excited about, he notes that the Medicare Innovation Center, which was created by the Affordable Care Act, has the legal authority to experiment with new models to engage patients for purposes of getting better value care.
Hyper-consumerism driving everything to a digital experience, because if we don't make it easy for patients like ourselves to use healthcare on our smart devices, companies like Apple are starting to do it for us.
I think we're right on the cusp of a huge digital transformation. It'll be interesting to see how CIOs sort of address that. Welcome to This Week in Health IT, where we discuss the news, information, and emerging thought with leaders from across the healthcare industry. This is episode number 50. Today we discuss digital transformation and its impact on healthcare, and we reflect on being a healthcare CIO in 2018. This podcast is brought to you by Health Lyrics. Health systems are moving to the cloud to gain agility, efficiency, and new capabilities. Work with a trusted partner that has been moving health systems to the cloud since 2010. Visit healthlyrics.com to schedule your free consultation. My name is Bill Russell, recovering healthcare CIO, writer, and advisor with the previously mentioned Health Lyrics. Next week is our last live episode, and over the last 2 weeks of the year, we're going to be airing the best of This Week in Health IT episodes. I've gathered some of the most commented on, liked, and discussed short videos from our YouTube channel, and I brought them together and given them to our production staff, and they are going to create a couple of episodes for our end of year. I hope you enjoy them and share them with your staff. So today's guest has such an impressive bio. I'm going to start there. So Lieutenant Colonel Chani Cordero is CIO for a 122-bed medical center located in Central Texas. She leads a team of 65 IT specialists in support of 4,500 staff members serving a population of 80,000 enrolled patients. She serves as a principal advisor to the CEO on all matters related to IT services. Chani Cordero is a fellow in the American College of Healthcare Executives, a certified healthcare CIO, certified professional in healthcare information management systems, holds a PMP certification, is an Agile certified practitioner. She received a Bachelor of Arts in Chemistry from St. Mary's University, holds a Master's in Education in Instructional Technology from Troy University, and along with that, also has a Master's in Healthcare Administration from Baylor University. In 2017, the U.S. Army Medical Department named Cordero the Mercury Award for Health Information Technology Professional of the Year in recognition of her contributions and demonstrated outstanding excellence in achievement in HIT. And not on the same level, but Health Data Management named Chani one of 30 rising stars in healthcare IT. Wow. Good morning, Chani, and welcome to the show.
Good morning. Thank you for having me.
Wow. And you know what? The amazing thing is that's actually an abbreviated bio. I noticed that you do an awful lot of teaching. You've been an adjunct professor and some other things. Based on, I'm just wondering how you get all that. How do you get so much accomplished?
Well, I have to admit, I don't do it on my own. I've been really fortunate in my career that I've had some great mentors that have just kind of given me or just pushing me to continue to strive forward and learn as much as I can.
Yeah, it is. It is great. I've had mentors my entire life. My first boss when it was an internship. I was 19 years old, became my first mentor. They do play such a huge role in terms of just the experience that they bring and just life experience and pouring in. So is that something you're now doing in the other direction? So are you now mentoring some people?
So absolutely. And so in one of my roles, I served as the deputy consultant for the Army officer as far as in being CIOs trained. And so from there, I had, the opportunity to meet, every member of our corps. And we're really small. We're about 100. There's about 100 of us, the United States Army. And so from there, I was able to form some really good relationships with folks. And so I have 6 mentees right now. And my mentee-mentor relationship, I try to make it's semi-formal in a sense. And so I want to be able to be open so that they are willing to discuss with me, both professional and career-oriented decisions, and personal decisions as well, but also formal enough to say, we need to discuss, routinely, we need to talk about all avenues, and don't call me when you need help. We need to discuss prior to that.
Yeah, I find the more gray hair I get, the more satisfaction and more excitement I get for the people I've mentored and their successes. It just it really is. It's a great satisfaction for me in my career, and I'm sure for you as well. Well, one of the things we like to do with our guests is to start with a really open-ended question and just give you the floor, and that is, what are you working on today, or what are you excited about that you're working on today?
No, absolutely. So I wanted to mention, I changed shirts, and actually happy I did, because today in the Killeen-Fort Hood area is red. So it's called Remember Everyone Deployed. And so I thought that this was actually pretty good timing. So we're wearing the red shirt today. So, but what I'm working on right now that I'm quite excited about in our agency is we are expanding virtual health. And so, this virtual health, telemedicine, has kind of been a buzzy word for the last couple of years, trying to figure out how do we, increase access, increase quality, for our beneficiaries. And, we're actually finding that the term is so general. We're trying to figure out, well, what does that really mean? Is a virtual health appointment an email to your provider? Is it a voice message left, or is it actually, synchronous communication where we're talking like we are, using some type of video platform? And so that is part of our strategic plan for our hospital, and we're really trying to peel back that onion in a sense of designating our provider templates of being virtual appointments, but then how do our beneficiaries actually use those appointments? And so are they calling, are they texting, are they logging onto a system? And so our commanding general has put out that we will use virtual medicine, and so it is all hands, use a Navy term, it's all hands on deck.
One of the things I forgot to do, and I'm going to go back here, is just I just want to note for our audience that the opinions expressed by you in this show, so your opinions are really your own. You're not endorsing anything from the Defense Health Agency or the U.S. Army, so it's just a discussion between two CIOs really looking at the things that are impacting CIOs. It's interesting to me, and we've talked about this on the show, that it's not so much a technology problem. I mean, receiving texts, secure texting in both directions, secure email, even the video platforms. These are not, in 2018, these are not challenging technology problems. It really is orchestrating the technology into the workflow, It's educating people on new mediums for delivering care. I'm curious, in the military setting, is it more top down or is it more collaborative? Are you working a lot with the clinicians to determine what works best for them and getting feedback and adjusting it?
Yeah, so definitely working with the clinicians, and and I would agree with you. The technology to deploy telemedicine, it's not very difficult. A camera, a phone, a computer system. It's not really difficult technology. But what I'm discovering is that a lot of emphasis is placed on the tools and not so much on the actual workflow of the process. And so we've had to, and we still haven't completed this yet, but what does this process look like from start to finish? And so, a patient picks up the phone. Well, we haven't even decided, well, is that telephone actually considered an appointment, or does the patient log in? What does that mean? And so as we're trying to even define what actually is a virtual health encounter, meanwhile, the other clinicians are saying, well, but the cards aren't up. The virtual health cards, needs updates. And it's like, let me focus on the technology. You tell me what type of encounter you want to use, and I'll tell you the right kind of technology that will go with that type of appointment. Yeah.
And that's the place they really want us to play. It's, is there an easier way to do this? We found it was kind of interesting that the pilot we did with telehealth, we spend an awful lot of time helping clinicians like we're doing right now. How do you look on the video presentation? Where should your eyes be? How do you connect with a patient? We talk about, how important it is to connect with a patient, be present and be there with them. Well, there's a whole new set of skills people need to, where do you look in terms of the camera to make that connection with the patient? And we spend an awful lot of time talking to them about, and actually getting feedback from them on what it was like to do those appointments, and then just adjusting accordingly as we expanded those programs. It's different. It's, and this is what we're asked to do as CIOs now. It's as other people have said, it's maybe 15-20% technology now, and it's an awful lot of instructional leader and organizational change and communicator, and there's all these people. It's 80% people, and it's only really 20% technology at this point. It's really interesting.
Yeah, and what I'm finding is, of course, that role of that CIO, right? And so like Chani and other, organizations talk about the CIO, 1.0, 2.0, 3.0. But I think that, culturally, people still kind of look at us as that technologist, right? And it's kind of like, well, we don't have a computer problem, so kind of like, why are you here? And so we're definitely have the skill set in the sense of understanding processes, is because it's like, if I don't understand your process and I don't understand your requirements, then I'm not able to support you. And so now, because of that, I'm pretty well versed on all of the different clinicians' roles and responsibilities, because I have to support them. And so now I can say, well, that workflow may not be the best way, because this clinic over here is doing it this way, and it's increased their efficiency. So maybe you might want to consider this for yours. And no, I'm not a provider, but I've seen it work somewhere else. So maybe you might want to take my advice.
Yeah. No, and I'm looking forward to our conversation a little later in the soundbite section, because you've been sharing a bunch of stuff on social media on how you interact with your staff and how you interact with the health system. So I'm looking forward to getting into that. But before we do two things on the show. We do In the News and then Soundbites. And there's been so many stories in the news. And what I'd like to do is just focus in on two of them that I think really strike at the heart of where health IT shops are. And, the first being Amazon to sell EHR mining software. And this is from Becker's Hospital Review is what I'm going to talk about there. And the second one is Apple in talks to give veterans access to electronic medical records. So I'm just going to read a couple of excerpts and then we'll go into them. So the Amazon story from Becker's, the software is dubbed Amazon Comprehend Medical. We'll use NLP processing, redundant, natural language processing, and machine learning to highlight key data points such as medical condition, medication dosage, and clinical trial reports. from EHRs and unstructured clinical notes that physicians can use to inform a patient's care. Amazon said its insights can help healthcare organizations with clinical decision support, revenue cycle management, and population health. Software may also free employees of clerical work, such as manually rifling through notes. So they're going to help us to really analyze the information that we have, and Apple's going to help us transport it. So Apple Inc. is in discussions with the VA to provide portable electronic health records to military veterans, a partnership that would simplify patients' hospital visits and allow the technology giant to tap millions of new customers, the Wall Street Journal reported. Under the plans being discussed, Apple would create special software tools allowing the VA's estimated 9 million veterans currently enrolled in the system to transfer their their electronic health records to iPhones. The Journal also reported an update to Apple's mobile operating system announced earlier this year includes a new feature to handle electronic medical records. The acquisition movement, anyway, I'm not going to go further into that. So essentially, in a digital economy, acquiring data, moving data, and analyzing data is really where value is created. Amazon's telling us they can help us make meaning of the data. Apple's telling us they can help us with the efficient transport of the data. And so we're seeing, as we were talking before that we started the show, there's like, I don't know, there's like 3 of these announcements a week, which means there's about 150 of them a year where, new players are coming in doing really cool stuff with data, really cool stuff with technology. And I guess from a CIO standpoint, how do you determine the nice to have technologies and the need to have technologies in this world? What do you do with these headlines when you read them and go, how do you determine which ones you should be focused on and which ones you shouldn't be?
No, that's a really good question. And, if you go to any HIMSS conference and you see the 50,000 vendors that have really great, neat products, you get overwhelmed and you want to use it all. But of course, we all know that we're limited in our resources. And so, foremost, I have to look at what is our organization's strategic plan. So what is the organization wants to go and what areas do we need to put our focus on? There's sometimes when a plan is not written very well, it is so open and broad that you can almost fit any technology into it. But it's really going back to my leadership and saying, or being a part of that discussion is, where do we want to go with this? And what kind of resources are you going to provide so that we can, make it? And a lot of times, some of these technologies out there are fantastic, but sometimes they're happy to glad in a sense. And so, does it really help our processes, or does it really, bring in that decreased cost or increase that access or increase that quality that we're looking for? Or is it just really a great idea, so to speak? Is it the Mercedes or is it the Honda? Both are great cars, and both work really well. But one really pretty and one just really rides well and dependable.
Yeah, I love that perspective. I was recently talking to a health system, and they said, "Do you think we should go to a single EHR?" And invariably, this is what we learn as CIOs. It depends, right? So you just look at them and say, "What problem are you trying to solve?" Mm-hmm. They said, "Well, why would that matter?" I'm like, "Well, if you're trying to solve a balance sheet problem, you're not going to want to make that huge investment. But if you're trying to solve a continuity of care problem, then maybe you might want to go to a single EHR. If you're in a state where you're still going to have a medical group that's all over the board, then you might need to solve the problem a little differently, because you still have to solve, even if you go to a single EHR in your acute setting, you still have to communicate with 100 different hospitals that are out there that are going to be on different EHRs, because you can't control them.
Right.
And so that question of what problem are we trying to solve really strikes at the heart of, your business or your community that you're trying to serve. What's most important to that community becomes, and I think that's, I like the Apple announcement with the VA. And the reason I like it is because right now what we're relying on is this mishmash of technologies to try to people from the VA move in and out of commercial healthcare, military healthcare, and VA, and we're relying on this mishmash of technologies. If Apple can really be that medium where a veteran can show up and say, I have my medical record, here it is, let me transfer it to you, I think that would be a pretty neat solution. I mean, what are your thoughts on that?
No, it's sort of agreed in a sense of does that veteran already have access to that record, right? I mean, when I kind of think about both articles, and it was really, thinking about kind of what Amazon is looking at doing is getting all of that disparate data and being able to put it in a format so that our providers can make a decision. It's going on the conclusion, in my opinion, that that documentation is there waiting for it to be found, so to speak, right? And so, I mean, I can't speak for private sector and how comprehensive documentation is, but I do know that sometimes in our settings, that documentation is very short. And, it's based off our EHR that gives you, the highlights or whatnot. Some providers, are very comprehensive in their documentation, and some, do enough that satisfies that encounter. And so when you have that variance of documentation, your data, your ability to comb through that data is going to be based on the type of quality of data you get. And so that would be my only hesitation about both of these kind of technologies.
Yeah, I agree with you. Overlaying NLP, machine learning, AI on top of the data really requires the data to be a strong foundation. The next week's episode is with Dale Sanders with Health Catalyst. And the whole episode is dedicated to just one topic, and that's data governance and data quality. And it seems like such a boring topic that I'm afraid to even pre-announce it because no one's going to listen. But you and I both know it's like the foundation for everything we want to do. It's the foundation for sharing data. It's the foundation for of analyzing that data and finding new pathways that are going to provide better access, outcomes, quality. I mean, in a digital economy, the foundation of the data is so important, and it may not be a sexy topic, but it is. It's such an important topic for us as CIOs, I believe.
No, and I agree with you. When the data quality people stalks me, I'm always like trying to go the other way because I know that is going to be a very painful conversation. But but to your point, though, it is definitely important what they do in ensuring the integrity and availability of the data. And kind of what you're asking before about the accessibility of that patient record for our veterans. I mean, what we all ultimately want, I think, as Americans, that we want to be able to people to take ownership of their healthcare, right? And so being able to have your records available to you so that you know and understand either your diagnosis and care plan so that you can make better life decisions or, better health decisions with that information. And so I think definitely what Apple is doing is a good thing. I just hope, of course, is that the data that's provided in there is factual and accurate data.
Yep, absolutely. So here's the exit question for this. And if this is more for me than everybody out there, I'm just curious. Do you think the adoption of digital technologies will be faster in the military or slower than commercial and nonprofit? I mean, both have their challenges. I'm curious if you think you're going to have the ability to adopt digital technologies faster than commercial.
Yeah, so I'm going to give you that wiggle answer, or we call it the Baylor answer. It depends, right? And so, one thing that I take pride in the history of, the government or the public sector is our adoption of technology was a lot quicker, especially the VA. I mean, VA, had the first DOE program, and we had our electronic health record in the late 90s, so to speak. And so, but we have been surpassed in a lot of areas when it comes to those digital technologies. Some of it is because of our acquisitions process. I mean, it's pretty comprehensive to ensure that, the government resources are spent appropriately, but it also can be long. And so why I say it depends is, though, there's areas that I think that we have resources, maybe that private sector may not have, because our ROI determination is different. And so, yes, we want to make sure that we are, getting the resources, or we're getting the credit, the RVU credit, or value for our dollar, but our main focus is readiness. And so if we have a piece of technology out there that may cost a lot of money, and we may not get that money back in savings or cost avoidance, but it provides a platform for our soldiers and sailors and airmen are able to perform their job, which is to fight and win wars, then we're going to spend those resources.
Yeah, I mean, there's so many similarities in terms of there's the bureaucracy within nonprofit healthcare or commercial healthcare, and the military is probably not that dissimilar. The sense of urgency to serve the community is probably there in both. When you decide to do an the VA is a great example of they decide to do a EHR project, and it just gets vetted. It gets vetted publicly, which is a huge deal. And that really is happening also in the commercial and nonprofit sector. If a major health system says we're going to move our EHR, that becomes, front page news in the paper, and a discussion of, hey, they're spending $1 billion heading in this direction. Is that really where we want them to be spending money? Shouldn't they, stand up a new cancer institute? I mean, so yeah, there's a lot of there's probably more similarities than I think. And so we're both wiggling on this. I don't know which one will be faster. They're both hard. Change is hard.
Change is hard. And the culture is also hard.
Yep, absolutely. So I'll transition to sound bites, because I'm really looking forward to this section. During this section, I typically toss out questions, and we get 1 to 3 minute answers. But for this week, I'm going to do something a little different, because I was in preparation for this, because we haven't. In all honesty, this is the first time we're meeting, but I really became aware of you based on your LinkedIn post, and I love your LinkedIn post. It's fascinating, because it's almost like I every week or so, every couple of weeks, you're posting something where I go, yeah, that's where a CIO lives. Yep, that's and I go, this is good stuff. So what I wanted to do with you is I wanted to highlight some of the posts that you put out there and just talk through them a little bit, if that works for you.
Yes, absolutely.
All right. So, we're going to start with the first one, which I like, and it starts with your transition. So you start by, I want to thank the dedicated professionals at the Defense Health Agency Education and Training Directorate. Give them a warm thank you. Fantastic opportunity that they gave you. After several years, we're able to provide impactful results that leads to greater efficiencies, enhance learning, and provide solutions that will positively impact our service members for many years to come. I'm also excited to start my new position as CIO, which we talked about earlier, and you talk about the facility that you're going to. I look forward to the new adventure as a new CIO. I make it a point to visit every single department and clinic. Here I am about to listen to the needs of the OR staff. And the two things I want to talk to you about on this one is the role of gratitude. I think, people who are successful are grateful people, and you see it over and over again. It's just a characteristic of who they are. They're grateful for their mentors, like you were earlier. They're grateful for the opportunities that people have given them. They're grateful for the great teams that they've worked with. So gratitude is one of the things I'd love for you to sort of comment on. And then the second is, you're starting a new role, and you're essentially saying you're going to go to every single department and clinic and listen. I want you to talk about your first couple of weeks in a new organization and what you're trying to accomplish. So.
Yeah, no, absolutely. And so, I have to say that my parents is the starting point anytime about any type of moral, I guess, something that you learn morally and stuff and whatnot. And so my parents, very proud parents, also served. My mom was the United States Air Force for 20 years, and then my father was also in the Army. And so, they taught me, of course, about just being humble and recognizing that, we're all one team in the sense of, when we try to do our accomplishments, that yes, you may be the one to execute, but, it's not necessarily something that you do on your own. And so my last job, I had fantastic bosses that were very supportive, gave me leeways to be able to execute IT in a way that I saw fit, more so than be micromanagers, because I've had that before. Hey, and it's a different environment to work in, and you can't really, be like that peacock and spread your wings, right? So, so I was really grateful of my bosses that allowed me to do so. And of course, just my staff alone. I mean, they were very supportive. I didn't have to deal with a lot of human resources dynamics that sometimes you have to deal with staff. I didn't have, that organization. I never had one staff member that threatened to go to the union because they didn't like a change, or this kind of said, well, this is not in my job description, to do, certain initiatives. And so I just really appreciate their willingness to kind of see the shared vision of enhanced learning that we did at our organization. And so, lastly, kind of with the, gratitude, sometimes I feel that I was lucky, but also I think it's just the way, how do you approach a job? And so, I'm a subscriber of that positive thinking. I know sometimes it seems like it's a little hokey, but, I sat at a conference, and I can't remember the presenter, but he talked about, the science behind positive thinking. And it's kind of like, well, let's do 3 positive things today, because they said that your brain will actually relive that moment in time, and you start focusing on that more so focusing on the negative. And so it's a practice that I do at work, but it's also a practice I do at home with my children. And so my 3 children, and they were as young as 4 years old, they could tell me their 3 positive thoughts of the day. And so if my 4-year-old, I have twins, and my 4-year-olds at the time would say, we ate pizza. That was their positive thought for the day. So, but to go over to the other part is that, yes, when I go to a new organization, to me, it's all about relationships in the end. And so I discovered in my 18-year career that you start, if you have credibility, if you have visibility, which is essentially, being visible in your organization, that will lead to credibility. Because people see you, they see that you're working your issues. Now, of course, you have to execute, right? I mean, if when I was going to one of the clinics, and it's funny you asked that question, because I was thinking this morning, I did a rounding in the inpatient side, and they brought up some cable management. And they really needed some assistance, because they were afraid that they were going to, pull the cable cord out or pull the printer cord out. And I was just thinking this morning, did I follow up on that? Did I send a technician to there? So I really need to do that. And so, but part of that, again, is being able to kind of form those relationships. So when there is a problem, and that they come to me first, instead of, going straight to my leadership channels.
Yeah, the rounding is so important, and in fact, we instilled it within our entire organization. But one of the stories I think is interesting. My wife was actually in one of our hospitals, and so I'm sitting there next to her, and she's either getting ready to go into, I forget if she's getting ready to go into or coming out of surgery, and we had just done an EMR migration. So I was talking to the nurse. I'm like, so how's the system to use and that kind of stuff? And she starts giving me all this information. And so I'm just sitting there texting, hey, they're struggling with this, they're struggling with this. All of a sudden, within like an hour or so, my staff from that hospital starts showing up and asking her questions and, stuff like that. She was like, she had no idea who I was, which was great at that point. So I just asked her, what's her experience with the IT staff, and she goes, at the hospital level, the IT staff was great because they had been embedded in the rounding. And she goes, I get an opportunity to talk to IT pretty often and to address my needs. She goes, it's great that they all showed up right after that conversation. She goes, but I could just as easily have had a conversation with them next week in our rounding session.
Yeah, no, absolutely. I think it's just important, and I've learned even it just is that sometimes when there's an issue that one of our clinicians have that, it's like for example, we had an issue with voice error. So these are badges that, you speak into calls. And so one of our providers said that, their voice error badge and wasn't working in a certain area. And so, prior to me getting there, it was kind of like, well, it's a network issue. It's a network issue, right? We have wireless and, it's a network issue. So the network engineer was just, hey, we looked at this, we can't replicate it or whatnot. And so then it was like, oh, well, it's a tech issue, right? It's something like physically wrong with the device. And so finally, I said, I want to do the trifecta. Let's send a network engineer, a trainer, and a technician, and I'll address the provider. So they sat down and discovered it was just a training issue, right? We were so quick to blame, the engineers or blame the technology, that we don't sometimes look at everyone who might be a part of that system. And so anyway, I just thought that was pretty funny.
Yep, absolutely. We're going to come back to your first couple of days a little later, but the next post I thought was interesting. So trust but verify. As a leader, we have to trust our staff, but we also have to be involved enough to really verify what they're telling us. And you talk about a situation where you're trying to deploy something. It turned out there was a failure in communication between the team on the system issue. And you say, trust but verify. The point isn't to place blame anywhere, but to ensure that the team has the resources they need. And then you ask the question, what are some of the leadership accountability techniques that you use? So when you say trust but verify, it's interesting because at my health system, we had 110 some odd projects going in at any given time. And I really couldn't be heavily involved. So there's a trust. I could only really be heavily involved in the critical projects, not necessarily all 110. So only about once a month, we had all those project managers. We set aside a day and we just listened to those project managers come in. And we gave them very specific instructions. Here's what we need to hear from you. Here's those kinds of things. So, but I really had to trust them that what they were doing was right. How do you go about, first of all, how do you go about staying involved enough in the various the projects that are going on so that you have a handle on each one that's going on? And then how do you verify? I mean, how would you go about verifying, I guess?
Yeah, so no, that's a very good question. And what I've kind of learned is that I do the same. So I have a project meeting. And right now I'm actually having to do it a little bit more frequently than I like. We're doing it weekly almost because I feel that we should revamp our project meeting. And so just like you always have just some very little surface level understanding, a surface level, idea of what's going on with that particular project. And because of that, sometimes when projects are maybe not on schedule or maybe not priority for that project manager or for that department chief, their answers are very general. And so I think maybe from teaching, my BS factor is really high and it's really sensitive. And so I'll start rapidly firing questions because it's almost sometimes you can see it's almost like a dying fish in the water, right? And I'm the shark coming in, like I can see when someone is not being quite honest. But I try to create an atmosphere though that that I don't want to press blame. I don't want to say, if you said, hey, I didn't have time to look into this, or I don't have the resources, but I didn't ask you because it's low priority, I can handle that. What I can't handle though is that you're blowing it off, or your integrity. You're having integrity issues. And so, when I'm having these project meetings and I'm answering the questions, if they say, hey, we're having an issue with the vendor. Oh, okay. Well, then that may be something on my level then, and you shouldn't be handling that. Let me call the vendor. Oh, wait. Actually, we haven't scheduled a meeting with the vendor yet. Oh, okay. So that's kind of where I mean is that, sometimes when someone's not telling you something right, then your spidey senses up and you kind of, go up in the air and it's not right. And so just asking those questions so that they know that, I trust you that you do your job, but I also need you to know that I'm engaged, and I'm an engaged leader.
Yeah. And we just, and what I think people need to know is we look at so many projects that we know when something's on track, not on track. And we're dealing with so much technology that we know when we're talking to somebody who really knows their craft and somebody who's maybe not as strong. And, just doing it over the years, we just know that when somebody's, spinning a tale, that you're sitting there going, okay, just answer these handful of questions. What's the status of the project? Right. What do you need from leaders? You just sort of narrow them down. It's like, I appreciate the story you're telling me, but just, tell me the status. Are there any risks? What do you need from me as a leader to make sure this is going to continue, and those kind of things. And sometimes the more people talk, the more you're like, I think there's a problem behind here. So let's just focus in on what we need to focus in on.
Yeah, no, definitely.
All right, so you go into, you're within your first 90 days of being CIO in a new hospital. You start to identify some things, and you talk about silos. This is, I've gone into a lot of organizations as a consultant, as a CIO, and as an interim CIO, and silos is deadly to an IT organization. And so when you identify silos, what are some of the things you need to do in order to break down those silos?
Yeah, so I agree with you. If your network team is not talking to your technicians, they're not talking to the trainers, they're not talking to the system administrators, it is definitely the, sympathy of death, right? And so right now I'm trying to just with the baby steps of just team building, right? So just, getting folks to actually talk to one another. And so I did a survey, my first few weeks in the position, and using poll everywhere, so it was completely anonymous, and it allowed the employees to actually answer the questions and answer them, hopefully more honestly than if it was like some type of sensing session or group therapy type meeting. And so got the baseline data, and and was really surprised to kind of see the results that I saw. And so first of all, we're trying to do some, team building exercises in a sense. And so we did bowling. We went bowling one day on a day that we had a very low census because it was a training. It was almost like akin to a federal holiday here on the installation. So very few patient appointments that day. So we went bowling. We are having a Christmas party, a holiday party coming up. And I am toying with the idea right now of fostering engagement, but I'm trying to, I have ideas of what that platform is going to be. And so right now I'm thinking something very low key, just I call it, CIO chat, Friday mornings, let's get together, let's drink coffee and just say, hey, what are the trends? What's trend? What do you see? My frontline desk, what are you seeing right now? In the organization, and my training, what are my trainers, what are the providers telling you right now? But I need to find a way to do it in a way that's collaborative and not finger pointing, because the environment that I came into, there is some frustrations between certain departments and their interactions with one another. And
yeah,
so
it's people, right? Anytime you have people, you're going to have you're going to have challenges. So what you're trying to do is you're trying to get them to interact with each other outside of work so that they can establish rapport, means of communication, see that maybe they share the same common mission, and see each other's perspective, I guess.
No, yeah, absolutely. And I mean, because again, this is my mantra: relationships matter. At the end of the day, relationships matter. And so, I tease my staff and I said, if I have to get big T-shirts that say "We get along," I will get them.
Yeah. You asked the question, what are some other things people do? One of the more successful things we did is, especially around this season, is we had departments and groups of people that went out and served in the community. They just, they did served Thanksgiving meal together. They did presents. They drove, they got presents for, underprivileged families and those kind of things. And actually, it was interesting. We found that those were probably the most effective, team building exercises that we did. I wish we had figured out a way to do them cross department, because that's where the silos really do get generated. So I found that interesting. But you're in the military. Can't you just look at this is like this is going to show my ignorance here, but it's like, can't you just say, drop and give me 20? Can't you just?
Oh, if only we brought those good old days back. So funny enough, my staff is actually, of my staff, about 65, 70 folks, there's only 2 military. So it's just me and my deputy. And so half my staff are federal employees, civil servants, and then my other half are DOD contractors.
Wow. So you can't. That's.
I can't. So what I do try to do, though, is kind of to your point. So we are looking at a community service event. And so I have one of my team members, teammates, is a avid runner, and so he gave me a list of about 15 marathons to run, and I said, well, can we find something that won't kill anybody?
Those common experiences is what you're looking for. I do want to talk to you a little bit. One of your posts was about Chime giving you the opportunity to sit on a panel discussing diversity, and I saw that. So that panel was you, one of our previous guests as well was on that as well. What are some of the things you guys discussed on that Chime panel that you think is important in terms of really helping us to understand diversity, diversity of thought, diversity of background, of experience, and what are some of the things you guys discussed?
Yeah, so a lot of times when we think of diversity, sometimes the first thought that comes to the minds is, looking at, race or gender. And what we're, really trying to discuss that diversity is just really people are different, right? And so, obviously, we all have implicit biases, and we all kind of naturally are attracted to people that are like us, either like-minded in thinking or, maybe share some physical traits or qualities. And we kind of, so we were just kind of talking about that, the studies are out there. So the statistics are out there, the research is out there that demonstrates that having that diversity of thought from people of difference to you will have greater productivity and, and greater benefits from that. But what that looks like is a challenge in itself. And so, I shared the example of in my last job working in a tri-service organization. So we had Army, Air Force, and Navy there. And because I'm Army, I didn't think how Army I thought. I didn't think, about the acronyms that I use or the analogies that I use were akin to being in the Army. And so when one of my Air Force peers or subordinates would say something, I I'm like, well, that doesn't make sense. Like, why would you do it that way? So, that, and so that's why, when we talk about diversity, it really is just a difference of thinking. And so, from that experience, and then, what we talked about on the panel is how do you, you have to actively seek that difference of opinion. And so, you have to, actively say that, in this tri-service organization, this is how we do it in the Army. Well, how do you do it in the Air Force? Or how do you do it in the Navy? I mean, I'm trying to care. I really don't, but I'm trying to care. I'm just kidding.
Yeah. No, well, it sounds like your father would be so proud. I'm not sure your mother from the Air Force would be as proud, but your father from the Army would be really proud that you've really adopted the Army ways. Did you ever have those conversations that why you chose one versus the other?
Oh, absolutely, absolutely. And so when I joined, I always joke about the difference in styles of recruiting. And so there's a lot of jokes of between all three services, and of course in the Marines and the Coast Guard as well. And I just said, the Army recruiter was just kind of like, hey, your test scores, are so great. Whatever job you want, you can have it, right? And the Air Force guy was kind of like, I'll call you when I'm available.
It really is relationships. It all comes down to connection and relationships.
Yeah.
I'll close on this last post because I love it. So as a CIO in healthcare, I'm passionate about healthcare. I love the potential and impact of technology. But some days when the stars are not aligned and systems are not working, I dream about switching career fields and trying to sell cupcakes. Everyone loves cupcakes, right? And I think every CIO can attest that there are some days where you come home and you're like, "What? This is nothing went well today." Well, you hang out with your family, you love your family, you go to bed, and you hope that you get up tomorrow, and tomorrow's not the same. So,
well, new day. That's right. So my 3 positive thoughts on those days is, I think I will have pink sprinkles, right? Because pink sprinkles are yummy.
That's amazing. Chani, thank you for coming on the show. I really appreciate it. I assume LinkedIn is where I'm finding your posts. Is that primarily where you're posting?
I am. Hopefully, there's some opportunities that I might start a blog with some various organizations. But right now, LinkedIn is where I submit all of my material.
Yeah, and I strongly encourage people to follow you. I think that your posts are insightful, and you close a lot of them with questions, and they really cause me to think. About emotional intelligence, about leadership, about even technology and approach and those kind of things. So I really appreciate that. So you can follow me on Twitter at the Patient CIO. The show Twitter account is This Week in HIT. Our website is thisweekinhealthit.com, and the shortcut to the YouTube channel is thisweekinhealthit.com/video. So please come back every Friday for more news, information, and commentary from industry influencers. That's all for now.